Good evening, friends. Welcome to Talks on the Rocks. Being a victim of allergies myself and observing that this is not a very commonly discussed subject, I decided to have this particular session while speaking to Dr. Samir Bhargava. A week, 10 days back, I think this topic came up, and that's how this entire thing has conspired. Let me start right away by inviting the gorgeous, beautiful Dr. Falguni Shah. Apart from being a normal MBBS doctor, she's also a DVD, DNB, FCCP. But what I do understand and realize is that Falguni, today you are a very highly qualified dermatologist and a cosmetologist, and in the top three, I think in the same bracket with Jamuna Pai and Dr. Trasi. That is what I hear from others also. Falguni is also the founder and the owner of the Radiance Skin Clinic, and she's globally trained. Okay, Falguni, welcome to Talks on the Rocks. Let me start with a very simple question. We all have a fair idea about allergies, you know. हाँ, इसको कांदा खाने से ये होता है, बैंगन खाने से वो होता है. Okay, but if one or two, like someone like me, if we have, let us say, 2 or 3 allergies, would it necessarily mean that my immunity is low?
So first is thank you, DR, for having me as a part of your forum. It's been a pleasure and absolute honor. Yes, a lot of allergies are immune modulated. So you can have inherited the autoimmune disorder, not necessarily that you have a particular allergy, but you may have a trigger to various other allergies. Autoimmune, as we say, is a big box. Autoimmune is people who have a history or personally past history or present history of thyroid or a family history of asthma, psoriasis, eczema. All this comes under the bracket of autoimmune. So one does not have to have just a sensitive skin. One could just have any one of this and it makes you a candidate for an autoimmune disorder, and by which you become more of a candidate for developing various allergies. So especially the food allergies, which I'm going to speak about a little bit in detail when I go through my slides with you. But yes, it's absolutely possible for you to have one of this. Also, I have seen that people who have an immune background are more prone to anxiety, stress, and that itself mediates the release of histamines from your skin. And that is why you may become allergic to various other conditions. Another thing about all this is when you are more prone to an immune disorder, the barrier function of your skin is less, which I mean that the skin has multiple layers, the epidermis and the dermis. And the epidermis itself has a barrier layer, which is 10% water content. So most often people who are more prone to allergies may be more prone towards dry skin, and lack of that moisture barrier makes you more susceptible to allergens from the outside. So it is a combination of your skin type, which again is associated with your autoimmunity and the immune disorder, which you may have inherited or developed over the period of time. So it is absolutely possible to be allergic to various other things and not just a particular allergen. That makes patch testing very difficult. So even if I do an allergy test, I may not be able to find out what you're allergic to.
I know someone who says that if I eat bananas, if I just have 1 or 2 bananas, I get boils and pimples on my forehead.
That is a myth.
That would be a part of skin and...
That could be a myth. That could be a myth, like, because I want to break this myth by saying that acne is not caused by any food ingredients. The largest myth circulating all over the world is that food is responsible for acne. Acne is absolutely hormonal, but yes, certain hormones can get triggered because of maybe a high sugar content sometimes, and that could make you get acne. But per se, those things of I had pickle, I had mango, and I developed acne, it doesn't hold true, dear. It's a myth. So I will come to that when I go through my slides, because there's a big difference between food allergy and food intolerance. These two are different things.
Would you like to start off your slides right away? Because I think you have a lot of content ready.
One is skin is the largest organ of your body, and almost absolutely everything that you feel inside reflects on the outside. And that's the beauty of it being the large organ. And also come up and say, oh, I'm allergic to this human being. I mean, I just cannot stand being in the same room as that human being. So what do you really mean by allergy? And what do you mean by an allergic reaction? Are they two same things? Let's talk about it in a lay person's view. Does this mean an allergy? One particular person is allergic to the other one. So this one has gotten under the skin of Kunal Kamra or otherwise. Well, you could call it. I may just want to check their skins to know if they have some allergic reaction to show too. But jokes apart, technically, a skin allergy is a reaction to an allergen or irritant. And symptoms could include a scaly, itchy skin, bumps, redness, welts, and rashes. What I mean by welts is those hives, or we also have the wheels, or I think in Marathi and Hindi, we also call it shiras. You say we have shiras all over our body. And that could cover your entire body or just a few areas, or be limited to the area of contact with the allergen. Technically, everything is red, everything is a rash, everything is itchy. But I've made them into 6 big brackets, which includes eczema or an atopic dermatitis, hives, which I just explained are raised itchy bumps, contact dermatitis, typically due to contact with certain allergens, a sensitive skin syndrome. Now, this is very often seen of late, where half the patients who enter into your office will say that, doctor, I have sensitive skin. I mean, they give me the diagnosis. Sensitive skin because of using various things which people have told them, a neighbor, a friend, and off lately, the Instagram influencers. So people who use a lot of products develop sensitive skin because of the same reason we discussed, DR, that the water content or the barrier function of the skin disappears. And then we have various infections like fungal, bacterial, which are also shown on the skin. And the new kid on the block, COVID rashes are all over, and they also look just like an allergic rash. So I'll give a face to all these names by showing you certain pictures. And I'm stuck again. Okay. 1 second. Yeah. These are 2 pictures of one out here. The one with the hand is a typical eczematic rash where you see red dots. And the one is on the right, my right, is hives or wheals or the urticarial rash, as we say. Here, this is a contact rash where you see the rash is just next to the belt or the buckle of the belt. And the other one is a round nummular rash, which is actually a fungal infection. So, and the third one is a bacterial infection. And then you have something where you have these small boils all over your body in a cluster, and that is a viral rash, or we say herpes, or you call it shingles. Now, a COVID rash looks pretty much like a viral rash too. And also sometimes as an urticarial rash, like you will have hives all over the body. We diagnosed a patient with COVID by an urticarial rash over again. It's a clinical diagnosis we need to make depending on what the lesions look like. Out of all these, only contact dermatitis and urticaria are 2 rashes which are allergy driven. Most of them are otherwise because of an organism or an autoimmune disorder. Contact dermatitis is something which develops due to contact with a certain foreign body. So it's an outside element. And in this, it could be something like an irritant contact dermatitis, which is because of a contact with things like, say, hair dye, which we call as the PPD or the paraphenylenediamine, and it is extremely common. Then the jewelry that you wear, the nickel in the jewelry, especially in the artificial jewelry and the belts of your leather, the buckles of your belt, alcohol in perfumes and cosmetics. And most of these cosmetics also have something called the balsam of Perim, and that's an ingredient which causes major irritant contact dermatitis, poison ivy as a plant, and then of course airborne with pollen. Now, irritant contact dermatitis develops, say, a couple of hours after a contact with an object and stays on your skin for 10 to 14 days. But in this contact, we also have a variant which is called the allergic contact dermatitis, which happens a few years later. That means that allergen is so weak that even if you're exposing your skin to that allergen continuously, your body is looking after that allergen. And suddenly after a year, you will develop a big rash. Now, for this kind of thing, we may need a patch test. And patch test is very commonly done of late to find out what you are allergic to. Then we have that urticaria, where I said you develop these hives, and it is extremely common. Your eyes are swollen, your mouth gets swollen, and they are all over the body. And this particular rash, you feel like rubbing your skin more than itching it. Causes medications, antibiotics, NSAIDs, aspirin. So you have people who've taken a Combiflam, say 2 days ago, and they come back with this whole rash on their body. And they rarely ever blame that Combiflam. And a drug-induced rash can be fatal. There is a condition called Stevens-Johnson syndrome, where you actually get admitted in the ICU and you may just pass away. Foods such as nuts, eggs, shellfish, wheat, etc. I'm going to talk on food allergies a little bit in detail. Infections like fever or influenza or flu itself causes a urticarial rash all over the body. A weak GI system because if you have worms, extreme temperatures or change in temperatures, especially of late, where people work in an AC environment all the time and then they suddenly will go out in the sun or they are out in the heat and they come back, that can make you break into a rash. Dust mites, pets, sun exposure. Now, sun exposure doesn't mean heat. So you could be out in the dry sun and it is cold and you will still develop an urticarial rash because of the UV intensity. The exercise by itself, so not just because of the tight clothing you wear, but exercise releases certain endorphins in your body in high content, which is called serotonin. And you could be allergic to a high content of endorphins too. And that itself gives you an urticarial rash. Latex gloves and just plain scratching. So those highly anxious personalities and stress-induced personalities, they have a constant habit of touching. They'll be touching their face, they'll be touching their body. And that contact itself makes you break out into an urticarial rash. So it could be just something as benign as you being a type A personality. Food allergies, DR, like we had discussed in the question, that most often we need to distinguish between a food allergy and plain food intolerance. Like a food allergy is something which develops just early in your life. Means it cannot happen after the age of 30, because by then you will be actually exposed to all food allergens in some form or the other. So food allergies are those genuine ones which are related to the immune system. And they are only a response to the protein in the food, like your nuts, your shellfish, your milk, eggs. The protein content is the cause out here. And they are also seen because of a deficiency of vitamin D. So we conclude that it is more seen in areas which are away from the equator, like a US, UK, where the sun is not too great. And this is a genuine thing. It's called hygiene hypothesis. So these extra clean environments, where in the early years of your life, you are not exposed to all the allergens. These could be fatal. However, a food intolerance is not related to the immune system and it is not fatal, and it does not occur only due to the protein in the food. It could react to the chemical, the color, the carbohydrate in the food, and it is most often due to a compromised GI system. But a compromised GI system itself can cause an urticarial rash. So we need to distinguish between these two. Food allergy, we do an allergy testing, we will come to know, but food intolerance, we will never be able to know the cause. So we have to build up the GI system so that you'll be able to tolerate all the foods that you want to eat. Now, these are just the skin things, like they have itchy skin and you have hives. But with this, there are a whole lot of other symptoms which my stalwarts like Dr. H and Dr. Samir are going to take up.
What is GI system? Could you just speak about?
Gastrointestinal system. I'm so sorry. The gastrointestinal tract. Sorry.
Okay.
And the other signs of your urticaria, like you have the sneezing or allergic rhinitis, swelling of the throat and the mouth, which makes it difficult to breathe. They come with chest heaviness and tightness in the chest. They can actually collapsing at the time because of a drop in blood pressure. The mouth, eyes are swollen and we call it angioedema. There is stomach pain, they feel sick, there is vomiting. So it's a whole lot of systemic things which are going wrong along with your skin. And it's one human body, but it is showing on the skin. So if we are able to clinically get the diagnosis by a visual skin appearance, we'll be able to prevent a whole lot of damage. So by doing, one is a clinical diagnosis, yes, but other tests that we can do is an allergy testing. And this can be done only for an acute variant. Like I said, if it could be an acute urticaria. So suddenly you've developed wheals and you've never had it in the past, or a contact with a object right now. But we cannot do an allergy testing for something, which you've been getting over a period of time, because that could be due to multiple reasons. A blood test, because if you know the hemoglobin, now people with anemia are more prone to getting allergies than the other people. Stool samples for parasites, because you will know if you have worms in the gastrointestinal system. Thyroid, to know if you are a candidate of autoimmune disorders. Liver function tests, because liver enzymes are a huge cause of allergies. And urine test, because women have calcium oxalate crystals, sometimes pus cells, and they develop generalized itching all over the body. So these are few tests we do, and the serum D3 and B12 levels to know your vitamin D levels. Treatment would be avoiding the allergen, oral immunotherapy if the immune system is really damaged, antihistamines, your cetirizine, fexofenadine. We have a new kid on the block called belastin, so a whole lot of antihistamines. Epinephrine if it is a fatal anaphylaxis kind of thing. And of course, you avoid aggravating factors like alcohol, caffeine, because they make your gastrointestinal system a little bit more sensitive and prone to getting reactions. So trying to bust few myths out here. One is allergies are harmless. Well, no, allergies can be fatal if the allergen has affected other systemic organs in your body. Moving to another region cures my allergies. A lot of people feel that, but if it's related to your immune system, it's not going to help. Big myth, natural organic foods. I will use only herbal products. I will use only natural foods. Complete no. In fact, they have caused so much more damage than your so-called chemically formulated products, because we really don't know the contents of these natural products. One cannot inherit allergies. You inherit the autoimmune disorder, so you do inherit your allergies. And allergies can be treated. Well, unfortunately, I would end by saying allergies can be controlled. I don't think they can be treated. So finally, a last slide to say that wearing a mask is important, not just for COVID, but it may help you treat your allergies too. And the takeaway would be one small tip from everybody out there, that skin being the external organ, if you keep it hydrated and you maintain the barrier function of the skin, which is 10% water, we will be able to pull ourselves away from skin allergies to a large extent. So hydrate yourself and moisturize.
Okay.
I'm open to questions.
Yeah.
Anyone has...
At your clinic, do you conduct allergy tests?
No, I don't conduct. I send them to an ENT very close to my clinic, and they have the whole testing unit. So I do send them to ENT. I'm sure Dr. Bhargav does it with his end.
Yeah.
Yes, of course.
So what we will do, Falguni, please stay tuned with us.
Yes.
Because there are a lot of questions coming up, and we will ask you these questions. Let the audience themselves ask you the questions directly later.
Yes,
okay,
absolutely.
on a one-to-one. Thank you so much for your participation. As of now, let me invite the very immaculate, polished, and suave Dr. Samir Bhargava. So Samir is a dear friend since a very, very long time, maybe 15, 20 years now. He has his own Bhargava nursing home, which is at Santa Cruz. He's also a senior consultant at the Hinduja Hospital, Khar. Incidentally, very well known for his activity in the social world. He's also the national president of the Association of Otolaryngologists, right? I don't know if I said it right. It's a bit of a tongue twister for a layman like me. He has been a gold medalist and a first ranker all through his academics, and is always invited and often invited to various ENT associations and events. Samir, welcome to Talks on the Rocks and the CEO Forum.
At the outset, I must compliment you, Deepak, for having put this show together, and thank you very much for having me on this meeting, and with such an illustrious company all around.
Since we are very much on the COVID topic right now, one question that has come from the audience: how does one differentiate an allergic cold from a viral or COVID infection?
So today, on everyone's mind is COVID, okay? And a lot of symptoms do overlap, but I'm going to highlight certain things which will tell us that, well, this is an allergic issue, and this is a common cold or another viral, which is a COVID infection. So first and foremost, generally people who have, a running nose, sneezing, colds, these have been having these allergic colds from a long period of time. Okay, and if suddenly something new comes up where you start getting a blocked nose or a cold or a running nose or a sneezing, then you start worrying. So what we found that actually a dry nose was one of the things that we noticed in a COVID infection. Itching and sneezing wasn't that common in COVID. So you can get a blocking, obstructed nose. You can get anosmia, which is the loss of smell. And now everybody knows that if there is a loss of smell, then that indicates that there could be a COVID infection. But allergic rhinitis also very severe, or if you have polyps, then you can land up with a loss of smell. Also fever. So fever is not going to be there when you have a plain and simple allergy, although one of the acronyms is hay fever, but there's no fever there. So if you have fever with the cold, then it straight away kind of rules out just a pure allergic problem. Also, allergies keep recurring or staying for a longer period of time. And no viral infection is going to stay for longer than, say, a 5 days or a 7 days or 10 days. So these are the main differentiating features which can tell us that this is a COVID infection and this is an allergic problem. And when we talk about loss of smell, okay, so loss of smell is something that is very, very common nowadays. I think more than loss of smell, loss of common sense is more common nowadays when we are dealing with COVID infections. And that's the reason why we are getting so much of COVID infection.
Tell me, would allergy also be hereditary?
Yes. As Falguni just mentioned, she busted that myth that allergies can be hereditary. In fact, so much so that if one parent has an allergy, there's almost a 30 to 35% chance of the child getting an allergy. And if both parents have allergies, there's a very high possibility that the child will develop allergy. So there is a clear genetic predisposition as far as allergy is concerned. And so you sometimes inherit the good, you sometimes inherit the bad. So unfortunately, yes, it is genetic.
Just to share, I heard of a person who has allergy towards tube light. Do you believe that?
So allergy to tube light, yeah, you have people who are tube lights. So, but you cannot be allergic to tube lights. So the thing is that there are certain things that are irritants, which are external factors. Some things which can be an allergen. Some things which, as I mentioned, are only, so people say, oh, I'm allergic to cold, I'm allergic to a perfume. So these are irritants, okay, not truly allergens. There's a difference. And while I talk about this, I will just emphasize a little bit about that while I'm presenting.
Okay. So let us have your presentation right away. Then maybe we can have a panel discussion later.
Yes. Now, as I mentioned earlier, that Dr. Falguni has given us the basics of what allergies are, and I will be emphasizing more on the comorbidities and how we manage allergic rhinitis, because allergy is not something that is often life-threatening. And an allergic patient looks like this, okay, with a handkerchief in his or her hand, with a blocked nose, scratching the nose or the eyes, or coming with a headache. So it's a very, a sorry condition, because it is something where you continue to suffer, your quality of life gets affected, but you still have to carry on with life. So you cannot call up your employer and tell him, boss, main nahi aa sakta, mujhe sardi ho gaya. Or the child cannot go to school and tell the teacher, ma'am, I couldn't do my homework because I had a cold or an allergy. So that's the sorry part. It's considered by everybody as a very trivial disease. And that's the reason why it doesn't get its importance. So to define what an allergic rhinitis is, it's an exaggerated, mark the words, exaggerated reaction of the body's defense mechanism to apparently harmless substances. So things that will not harm someone else may cause a problem to you. And these are coming from the environment. So it is generally an external factor which is triggering this whole thing off. Okay. And it happens in people who are sensitive, allergic to certain substances. This is not a problem that is only in India. It's a global problem. So in fact, it is the fourth most common chronic disease in the world. 25 to 30% of people have an allergy as a problem. And out of all the allergies, why we have so much of emphasis on the nose and the allergic rhinitis? Because more than 55% of people who have allergies will have allergic rhinitis. And at any given point of time, there are more than 500 million people who are suffering from this condition. But in spite of all this, because it's considered trivial, it is under-recognized, underestimated, and undertreated. Now, Dr. Falguni has already mentioned all the various causes for allergy. So as we call them, allergens, substances which when enter into the body lead to this allergic symptom. So we really divide them into two categories. One is the outdoor allergens. So quite often it is the pollen, mold, smoke, etc. are irritants. They are not really allergens. Okay. And the commonest indoor allergens. So where you have the dust mite. So when we always talk about, oh, there's so much of dust and we're allergic to dust, quite often it is to these very, very microscopic insects, the dust mite. Okay. Molds, fungi everywhere, and particularly in the monsoon season in Bombay, particularly, we have a lot of fungal allergies, insects, cockroaches, pets. So a lot of people have pets at home, and the animal dander, so which is the saliva of the pet on the hair, which is completely your bed may be completely flooded with that, and that's one of the primary causes for allergy. Falguni did mention that you cannot be allergic to people, so you could be, your mother-in-law could be an irritant, but you cannot be allergic to them. coming to the symptoms, so classically these are the four symptoms. So you have itching in the nose, you have frequent sneezing, and it can be many, 10, 20, 100. Running nose. So we actually label our patients as runners if they get watering all through the day, or the blockers where they complain only of nasal congestion, which is an obstruction. So primarily what is of most concern to people is this running nose or the blocking of the nose. There are various other conditions that we need to know about, and that's the reason I'm highlighting this, because as I said, we always think that it's just a trivial condition, but it can have many other organs that get affected, and that is why we need to be aware of this. So allergic conjunctivitis, which Himanshu will be elaborating on, bronchial asthma. So this is something that many people do not know, that we have a unified airway. So the upper airway and the lower airway is one passage. So that's why a lot of patients with allergic rhinitis can have bronchial asthma. In fact, can asthma begin in the nose? And the answer to that is yes, it can. So that's why we must try and control our allergies, so that if you are asthmatic, allergic asthma, you can reduce the impact of that asthma. Coughs, sinusitis, so that's infection going from the nose into the sinuses, which are the hollow spaces by the side of your nose. The colds can affect the ears, and you can land up with infection and fluid collected in your ears. And of course, the loss of smell, as I mentioned, anosmia. That is something that you can occasionally get, but nowadays more commonly with COVID.
Okay.
When we talk in terms of allergic rhinitis, we talk in terms of whether it is intermittent or seasonal. These are very often due to pollen, outdoor allergens, and the ones that are all through the year, and very commonly it is due to dust mite. Again, how do we come to know what we are allergic to? So really speaking, you need to do an allergy testing to come to know what exactly, because if the mind does not know, the eye will not see. So you need to know what you're allergic to if it has been troubling you significantly. So that's where the allergy testing comes up. And the allergy skin prick test is the one that is the gold standard. You do have these blood tests where all these labs have, and they are sometimes not as accurate. So the skin prick test is the one that we treat as the gold standard. Of course, you can do some what is known as specific IgE test, and you can come to know if you're allergic to a particular item or no. And why you need to know? Because only then can you institute the specific avoidance measures, and avoidance becomes a major part of the treatment for this condition. So this one slide will sum up how we treat. So the most important thing is to identify the allergen and avoid that. And then we have all these drugs and medicines that can be helpful. So we've all heard of the anti-allergic antihistamines. And in the good old days, you had these molecules which would actually put you off to sleep, knock you out, so much so that some antihistamines were associated with impaired performance comparable to 3 single shots of whiskey without having the whiskey. And today we have much better medication. We have medicines that do not put the child or the adult to sleep, so then they can work effectively in school or at workplace. So depending upon how severe the conditions are, depending on how we label them as mild or moderate or severe, which means if they are impairing your quality of life significantly, we label them as moderately severe. We decide on what kind of medicine we need to give. Now, steroids are always looked down upon, but in allergy, the intranasal steroids, which are the ones that you, just as you take inhalers for allergic asthma, you take these nasal sprays and they do very well. You can take them for a long period of time without the side effects that are always associated with steroids, because the dosage is in micrograms, unlike when you take a tablet, which is in milligrams. So 1000. So you can imagine how less would be the side effect due to that. And if all these things do not effectively treat the patient and the patient is still uncomfortable, or if the patient has been taking these medicines for a very long period of time, that's where we look at vaccines. We look at immunotherapy. Again, Dr. Falguni briefly alluded to the fact that it can be taken orally. So a few years ago, it used to be in an allergy shot, which is injecting the vaccine. The disadvantage being that you had to go to the doctor a number of times to do that. Whereas now we have what is known as the sublingual immunotherapy, which is SLIT, slit. And this is very convenient. The patient can take it at home. The only drawback being it's a very long treatment. You need to invest 3 to 4 years into this oral immunotherapy.
Okay.
And as I said, that the allergy needs to be addressed. We cannot ignore, because it has an impact on your quality of life. And now locked up at home, we all realize what quality of life is all about. It can lead to comorbidities like asthma. So we need to make sure that we treat the nose better so that the asthma doesn't come up. And we need to avoid certain things, look at medicines, and as a last resort, then look at the vaccine, which is immunotherapy.
Thank you, doctor. One last question.
Yes.
One has a tendency to pop in tablets,
Yes.
Allegra 180 or Cetrazine, And I know of a lady who had an allergy which you'll be shocked to hear. She had an allergy to water. Do you believe that? An allergy to water, yes. So the question is, how does she manage to drink or whatever? But this is a fact. She is a friend's wife, and for many years she was going through it. This afternoon, I spoke to my friend. I asked him, what is the situation right now? What's the status right now? He says she's been popping in cetrazines for a very long time. And now, since the past few months, she has reduced considerably. Her water used to give her rash problems, So whether it's even a bath or something, she would resort to sponging. Now, that is the kind of allergy which is really, really different.
No, Deepak, I would not concur with that, because as I said, if you have an allergy, you can always test it out. But allergy to water is almost unheard of, because you have been consuming water right from your birth. And
right.
I would like to actually highlight one thing that Falguni did mention, something about the hygiene hypothesis. Now, this is very important, because we find allergies are on the rise, and one of the reasons given is this particular thing. So you'll find that in the Western countries, allergies are far more common. In urban India, the allergies are far more common. In rural India, the allergies are less. And the reason being that allergic diseases, these are all caused by what is known as an inappropriate immune response to a harmless antigen. And this is driven by something known as a Th2 mediated response. When you have an infection, you have a Th1 response. If you have had an infection in childhood, automatically your Th2 gets suppressed. So if your house is very clean, if your children have never had a bacterial or viral infection in childhood, your Th2 continues to be high. And that is the reason why in urban India, you have more allergies than in rural. Need to catch these allergy very early, because there is a condition called as allergic march. So we are in May, but we are talking about an allergic march. And in childhood, if you have a skin allergy, it can move to a food allergy, it can move to a nasal allergy, and then an asthma. So if you catch it in the initial stages, you may be able to catch it before it develops into something dear.
No, allergy shots. It's an injection, right?
Yes.
And is that the same thing you mentioned, that it's a 3 to 4 year course?
Exactly. So earlier it was known as an allergy shot because you actually needed to go to the doctor, or you could even take it yourself, but that's very risky, which was an injection. Now it has been replaced. So it was earlier called SCIT, Subcutaneous Immunotherapy. Now it is a sublingual. It's an oral drop form. So it's a that's what has completely changed the whole allergy treatment. So no longer shots, but just in the drop form. Okay, which you can take it at the convenience of your house. You don't have to go anywhere. You collect the stuff, whatever is required from the doctor, and then take it.
Any specific brand?
No. These are completely tailor-made. So first you need to do your allergy test, find out what you're allergic to, and then these vaccines. These are also kind of vaccine only, because you're getting. That's how you will land up with a treatment. So these are completely need to be made, and there's no company that makes that, in the sense that we don't have a brand which is kind of making this only.
Okay. Thank you, Dr. Samir. Thank you so much. It was very informative. Okay, please stay tuned. I will now invite our dashing, dynamic, handsome Dr. You know who, Himanshu Mehta. Dr. Himanshu Mehta, please. Since 30 years, the suburbs have seen this handsome guy whose byline is "For Your Eyes Only," straight out of a Bond film. Yet another gold medalist and a first ranker. Dr. Himanshu Mehta is extremely well known from the suburbs onwards, right up till Dahisar, wherever, and also in parts of South Bombay. He is currently also the president of the India Intraocular and Refractive Society. We all know him as a brilliant speaker, and he has his own channel, The Good, the Bad, and the Handsome. Am I right? Okay. So, Doctor, I don't want to ask you too many questions. You know your subject. Please talk about eye allergies.
Sure. Thanks, Deepak, for allowing me to be there in this forum. A pleasure and an honor to be there. Thank you, Neha, and thanks, Samir and Falguni, for a wonderful talk proceeding. What I have to say, friends, eyes are a reflection of the rest of your body and what you can't see in the rest of your skin. Allergies in the eyes are a very general substance. As he said, Samir just said that in March you get allergies. There are various kinds of allergies that we have in the eyes. Quite often, a lot of allergies, are reflected because of medications, overuse, abuse. But what is going on presently is what I'm going to stress on. Let me start with my presentation, something very simple to start with, because a lot of it has been covered up by my previous speakers. What comes here is the seasonal allergic conjunctivitis, the vernal keratoconjunctivitis, atopic, giant papillary. So any conjunctivitis which you see in a colloquial term can be bacterial, viral, fungal, or allergic. So it's all conjunctivitis are not the same. Red eye does not mean it is conjunctivitis. In a bacterial infection, you will get pus and all. In a viral, you will get watering. Allergic one, you will get severe itching, maybe followed by sneezing, an atopic rash somewhere else. So this is how we differentiate grossly. So don't mistreat and treat them on your own, because a lot of steroids are used and abused by people. There are allergies to, if you get tuberculosis in the body, you could get a flictanular keratoconjunctivitis, a small allergy which can come up in the eye. You have keratoconus, these young children. If a child is rubbing his eyes tremendously, tremendously worry that the child may have a number. This is something which I want to tell everyone, for their grandchildren, for the family around them. Don't neglect a child who's rubbing his eyes, who's got constantly watering, that, this is some kind of nonsense that the child is doing. It could be a premonition to having a number. An allergy could be showing me that exactly what is going on with the eyes. So it could be tearing, rash, running nose, redness, all the other things could be associated.
Let us talk about dry eyes in this current COVID pandemic. It is a huge problem that is affecting millions of people in the world right now. Are you experiencing any of the following symptoms? Are you watering more than usual? Eyes that feel red with a lot of burning or itching? Are you having sensitivity to light, or a foreign body sensation, a desert-like grippy feeling in the eye? It could be because of a multitude of reasons, like some allergic conditions, air pollution, excessive amount of time on the computer or your smartphone. increased indoor time in the air condition, overuse of eye drops, and many, many more. But don't be worried. You can start feeling better.
What I was trying to say that these are things which are commonly seen and what affects because of so online schooling. What has happened today with the eyes is tremendous problem because the school work from home WFH or school from home is 6 to 8 hours of work screen on that. Social media scrolling couple of hours because there is too much of information to be caught on. And then, of course, the next 2 to 3 hours goes on relaxing with Netflix and the television and Arnav shouting on what's happening with the COVID scenario in the world. As a result of which, whether you use your hands, your legs, your heart, your lungs, whatever, but your eyes are being constantly bombarded for almost 12 to 16 hours a day with a lot of abuse, use, overuse, and misuse. Which is why we have a lot of patients complaining of red eyes, watering, burning, foreign body, discharge, blurry vision, headache. Now these are taken as allergies. Let's look at this. I wanted to show you some live examples of patients.
Are you experiencing any of the following symptoms?
Redness, the eyes are getting blurred for a second and itching, sensitive towards the light. Headache in the evening. Irritation. Redness of the eyes. Burning and stinging sometimes. Irritation. My
dry eye sensation becomes blurry.
Yeah, headache.
Body sensation I do have. I completely dries up.
Soreness and painful. With a few pain out here on the upper lid.
Discharge too much.
Foreign body sensation.
Irritation in my eyes.
Watery.
Been for around 12 to 14 hours a day.
Burning.
Too much of water.
Tired in the eye. The water comes out and
I can't see properly. Blurriness in the eye.
more of watering.
Some sort of dryness, some discomfort throughout the day.
Hurting. The eyeball is hurting. Right eye especially. That feels a bit blurry.
Definitely 10 to 12 hours.
14 to 16 hours.
Pain also in the eye.
Reddishness.
Dizzy.
Headache I have a lot.
Blurriness.
That heaviness.
If you are also experiencing such problem,
So this is what I wanted to tell people, that something which is going on at this time, which is affecting most people after almost 14-16 months, and we still have to go on for the next few months, the amount of eye problems which have increased. And allergy is a small part of it, but the use, abuse, misuse which has been going on. So without wasting more time, we have spoken enough about it. There are medications which have to be used. There are lubricating eye drops. You have to take care of the allergy, reducing the screen time, lots of stuff. But one thing that I would tell, reduce wearing contact lenses for a long period of time. They are cosmetic. So only if you're going out to meet people, which you are not during the pandemic, don't do that. Reduce your screen time, which is increased phenomenally right now. And that is what is creating a lot of trouble to people. You may give it under the name of work from home, from office and all that. But simultaneously, your WhatsApp, your Netflix, your Instagram, and regularly updating yourself every minute, giving rise to a huge new pandemic of eye problems. So this is awareness that I wanted to get. Besides boring anybody about allergies, we can treat them. Medications, I've been told by Samir. I would like to go for questions, Deepak.
Yeah. And can you please organize the question?
So allergy is an opportunity for doctors, but it's a pain for chefs. In restaurants, we get people who say, we're allergic to this, allergic to this, allergic to this, now make a menu. So are there things that at home we can say that which are good? So I understand antihistamines in food we study, right? So are there a few, let's say 5 ingredients in food, which has more instances of allergies at home, which people should eat and probably get less instances of allergy?
So I'll take that one, Sanjeev. Good evening, Chef. So one thing, as I said, that a big difference between a food allergy and a food intolerance, and more often than not, the protein content in that food is what gives you a stronger reaction than the other things. So in such cases, what we could do is they could start with an almond milk at home and then probably graduate to the cow's milk. And sometimes like we do with young infants, if you start with the cow's milk, you dilute it to 1:2 and then give. So you could ask your people who are allergic to, for example, milk, you start in the diluted form. For example, if somebody is allergic to seafood, that we've seen it very, very often that people say that I'm allergic to seafood. Maybe they could not do the shellfish first, but start with another variant of the fish at home. And then because the shell in the shellfish generally has more protein content than the fish. So they could start with the fish at home and then maybe work towards it, because more often than not, it could be a food intolerance, and that's what they need to get over. So, but if somebody's allergic to peanuts or wheat, then I'm not really sure. The wheat allergy could also be something like a celiac disease, which is completely an autoimmune disorder. In such cases, you can't do anything. They will have to be off the wheat. So determining what it is important.
That's the vegan diet, the whole fad of the vegan diet which started.
Yeah.
So I got tested on allergy, I think IgG or IgE test a couple of years ago, and they did the 400 ingredients, and there were about 40 which I was allergic to. And it included onion, cashew nuts, raspberries, and everything. And then they said, okay, after 4 months, you introduce small quantities and then see your reaction to this. So actually, to be very honest, there's nothing that I was really allergic to. I did that test because somebody wanted to do that test on me probably. And I have not had any severe thing, thankfully. So are these tests meaningful where you get all these tests on different ingredients, whether you are allergic to something or not?
So, chef, if you have a food allergy, like I said in my presentation, that if it is a proper food allergy to that protein content, you would know it early on in life. Something which you cannot develop a food allergy which is fatal at the age of 30 plus, because by that time you've been introduced to all those allergens in some form or the other in your life. So yes, I am not sure whether a food intolerance, if you have, then doing an allergy testing really helps. But yes, if it does turn out that you have done your allergy testing, then you can, the right way is what you did or what they said you should do is introduce small amounts. And
I would like to take it from there. So Sanjeev ji, the thing is that as far as the nose, so respiratory allergens are, most commonly it is dust mite, which tends to cause a problem, not so much food as far as the respiratory allergens are concerned. Also, you can have a mild form of an allergy, which is not kind of, causing you significant discomfort. But if you check that, if you check for house dust mite, and if that is the most significant one, then that is the one that could be causing you most of your symptoms. Whereas skin allergies, yes, a lot of food items can be a cause for the allergies. And peanuts and seafood, these two can sometimes be fairly dangerous. In fact, the US, so they can land up with a lot of, edema in your breathing passage. You can also choke. So that's the reason why on American flights, I think way back in the late 90s, they discontinued peanuts. And it was not because of economizing, it was because of this particular reason.
Thank you.
And that's where the EpiPen shot came into vogue. So people who have severe seafood allergies, they actually sometimes carry their EpiPen along because, you're in a restaurant, if you can't do anything, the only thing that can save you is probably that epinephrine shot.
Sure.
Yeah, thank you. I have two questions. One is for Dr. Samir. If you can, highlight a little more about chronic sinusitis, because we've seen a lot of, youngsters today, who have been suffering from sinusitis. And when you take any of these antihistamines, I mean, you get relief, but then it doesn't last for a long time. After a couple of weeks, it comes back. It keeps recurring. So if you can highlight a little more about how do we actually manage chronic sinusitis? That is one question. And the second question to Dr. Himanshu is, I recently read somewhere that conjunctivitis is one of the symptoms to identify COVID. So is that really true, or because nowadays you get so much information on media, we really don't know what is right and what is wrong.
I'll take it first. Sorry, Samir. I'll just answer his second part because it's fresh with me.
Thank you.
Absolutely, eye symptoms are a present problem at this point in time with COVID. I've had conjunctivitis patients being treated on telephone, and I've seen them in personal. Yes, that's one of the symptoms. The new thing which is you reading about everywhere is mucor mycosis, and a lot of swelling in the eyes, redness, and all that. I will tell Samir to talk about it a little more because he's better secured.
Right.
This is what is creating a lot of trouble, and a lot of WhatsApps are being forwarded at this point in time. First, don't get worried. It's not going to happen to everybody who's in the hospital. But yes, people who are comorbid with diabetes, extensive hospitalization, more oxygen, ventilator, steroids, and are immunologically suppressed, they can get mucor mycosis from the nose onto the brain and the paranasal sinuses. So huge thing going on right now about this mucor on WhatsApp media. Don't get worried. Yes, it's a problem. We are aware of it. Samir and me are aware of it from the past 3 months. We have seen those patients. But it has to be managed, and it's a hospital management. It has to be aggressively managed. Get it treated quickly. Go ahead, Samir.
Thank you.
Yeah, thanks, Himanshu. So coming to your first question, Ashwin, see, when we talk about allergy, I need to highlight the fact that allergies can not be cured. They can be controlled. They can be cured only in two scenarios. One is if you completely avoid that allergen, or two, if you modify the system by going in for the vaccine, right? So that is why allergies, while you are taking medicine, everything is fine. But the moment you discontinue, they tend to come back.
Correct.
So please do not equate sinusitis with allergic rhinitis, because it is recurrent. Okay, it's the allergy part which is recurrent. Sinusitis happens when you have either a allergy which has gone into the sinuses, or some bacterial infection that has come up, or viral infections, along with some kind of a mechanical or a static obstruction to the drainage of mucus that normally collects in the sinuses. So when this doesn't happen easily, that's where the mucus tends to collect, stagnate, recirculation of the same infection that is there, and then you'll end up with sinusitis. So you can have an acute sinusitis, which is immediately following an upper respiratory infection, but you can have this scenario continuing for a long period of time when we call it chronic sinusitis. So it's always chronic rhinosinusitis. There are many factors and they need to be addressed. Quite often we need to do a CT scan, find out if there's an obstruction. If I can give you a small simile, if your road is obstructed, it is due to the road being narrow as well as the traffic being more. If there is a road divide side, that side is blocked. That's what happens.
Yeah, sorry, go ahead. Yes, Doc, does that mean people with a deviated nasal septum tend to have are more prone to sinusitis?
Yes, they are more prone to sinusitis, but a lot of people have a deviated nasal septum, and the allergic rhinitis is not because of the deviated septum. That's why let me also highlight the fact that allergies cannot be cured surgically. We do not want to operate any patient with allergy. Only if the patient is having blockage of the nose, cannot breathe, in spite of taking all the anti-allergics possible, then in addition, as an adjuvant, we will look at doing a surgical correction. So a lot of nose surgeries have earned a bad name because the correct indication was not there for the surgery.
Okay. Thank you, man. Thank you so much.
I would also like to make a little mention about this condition called mucor mycosis, since Himanshu has raised that topic. Yes. So in the last few days, there has been a huge, if I may say, scare in the general population. TV channels are coming up with this, lots of WhatsApp university, circulating all over. There are a couple of even newspapers. In fact, there is one which came up just yesterday in Times of India where we had, I had commented on this particular condition. Now, mucor is a fungus. It is a normal commensal in your body quite often, which means that it is cohabiting normally without creating a problem. The moment your immune system starts getting affected, your immunity goes down. COVID causes a reduction in your immunity. Steroids, which are being used, can cause a reduction in the immunity. The other medication that is being used can also cause, and the most important thing being diabetes. So a lot of people do not know that they are diabetic or pre-diabetic. Steroids are given because at this point of time, we have found that steroids are the best treatment for COVID. Of course, they have to be used judiciously at the correct time. A lot of times they've been used very early, which is incorrect. That's a separate topic. So whenever you are given a steroid, your sugar level does go up, but you should be aware that you need to monitor that. So the glycemic control is very important whenever you are controlling and giving steroids. So people are all aware of that. The general public needs to be aware that if they start getting a lot of dryness in the nose, or if they start finding any kind of a blackish discoloration develop, warning signs that you could be landing up with a fungal infection, which now, because of the low immunity, is starting to raise its head. So awareness is important, but unnecessary scare should not be there, because then we'll find people, trying to self-treat themselves, doing scans and unnecessary things, and not taking the correct treatment. So you take steroids because that is the only way we know as of now that can control the immune response, the cytokine storm, etc. But we also need to monitor our.
So a question by Kishore Kothari, allergy to medicines. He's written on the general one. Very important question. Is a doctor is asking question that you could be allergic to amoxicillin or any penicillin, but sulfas, but allergy to paracetamol. How to remove the stains developed after sulfa drugs? So can you have an answer? As we know, Dr. Kothari, that B complex also we can have allergy. Patient could be allergic to anything. And what Deepak said today, somebody allergic to water. I mean, amazing that human body can neglect anything. But it's not an anaphylactic reaction. You can get a mild reaction which could be taken care of. And which is why one more thing that I want to tell everybody, that when the vaccine is given, a lot of questions came on my talk show that if I'm hypersensitive, I get keloid scar. If I get hypersensitive to something else, should I take the vaccine or not? Yes, you take the vaccine, and that's why the vaccine guy, the center, tell you to wait there for half an hour. And anaphylaxis can only occur in the first few minutes. It will not have to happen after half an hour. You may get a rash, but you will not die at home. So dying because of an anaphylaxis later on is not a possibility. Don't get worried. Even if you have allergy to sulfas, penicillins and all that, or you are hypersensitive to many things, nothing is going to happen to you. Most often than not, nobody has died. There was one classical case of a physician in Boston, in Harvard University. He used to be allergic to many things. He got a reaction after the vaccine, but he had his EpiPen with him. And he took the EpiPen and got better. So don't worry. Do take your vaccines with other things with any of the patients can be taken.
I want to add that I've seen many people have come after a COVID vaccination with an urticarial rash, and it generally settles in 24 hours. So there's nothing to worry. It doesn't go on, and it has nothing to, it's like they come and they say that, oh, I think I have reacted to the vaccine. It's nothing like that. It's a temporary rash and it goes away completely, even if it's 24 hours.
So to answer Dr. Kothari's question, that the best thing to do if you know that you're allergic to a particular drug or molecule is avoidance. But if it so happens that you cannot avoid it for certain reasons, for example, sometimes you have aspirin sensitivity and you sometimes need to take that aspirin, you can always go in for a desensitization, which is you give the same molecule in a very minuscule dose, build it up over a period of days to weeks, and then you need to be taking that particular thing for a longer period of time after having stimulated your immune system to be able to take it without creating an allergic response. So we have patients who have drug allergies and they can be countered by, as I said, either avoidance completely or doing something to improve their response.
Do you have any personal allergies, Dr. Samir Bhargava?
No, I personally don't have any food allergies, but I do have allergy to dust. So sometimes I need to pop my antihistamine, which can control certain things. But food allergy is definitely not an uncommon thing. And I think Dr. Falguni spoke very, very much in detail regarding all that.
Okay, so I think we have overshot our time. We are fortunate to have a legendary personality, Ganesh Nayak himself, to come and do the vote of thanks. I just want to share something. I'm a victim of very unique allergies. Can you hear me clearly? I can hear my own echo, some problem.
I can hear you loud and clear. Go ahead.
This is very strange. If I eat ground nuts or any form of nuts, within 24 hours, I get massive blisters in my mouth. So I refrain from any of that. If I eat anything that's deep fried, it could be fish or pomfret or anything, or even kurkure, bhajiyas, samosa, anything, I get massive blisters in my mouth. If I have a banana or what is the other item? Banana or there's one more item. I get a kind of acne on my forehead. It is very, very small acne. And it goes off if I have a particular medicine. I don't recall the medicine now. But most shocking is I used to get massive body pain Body pain to the extent that I used to be crippled. It would hit me on my backside, right up to the back of my leg, and right down to my heel. Getting up was almost impossible. If I'm in bed, getting up from the bed I was like a 90-year-old man. Absolutely crippled. It took me a while to realize it was nothing but garam masala. Garam masala was the ingredient which would create this massive pain. So the moment I completely stopped having garam masala in my food, garam masala powder, I have no issues. So this is some food for thought. You know, the kind of allergy.
One of the ingredients, basically the DR, it's like one of those Chinese thing which has been blamed tremendously in Chinese food. It has got a bad name. What do we call it, Falu?
MSG, monosodium
glutamate. Yeah, MSG. Yes.
MSG.
That has been a common blamed substance, which not necessarily gives rise to that, but people have blamed it. But in your garam masala, one of the components you are allergic, and that's the beauty of the human body. The known allergens are penicillin, sulfa, peanuts. Like children have celiac disease, so milk allergy. But there are so many which we are not aware of, and I'm ready to tell you that in medicine we don't even know many things about the human body. Best is the way you did it. You found your own answer. That this is what give me a reaction. That is the most practical, real answer of life.
It took time, but one has to really observe and make notes.
Nobody can help you at that time except you yourself. No dietitian knows what is going on with you.
Second is a lighter vein. 3 years ago, when Deepak and Ashwin and we were eating together, he made a mention about this allergy of fried fish. And chef, this is more from your point of view. Something through my chef, a new concept called a water fried fish. Now, what it is, we will discuss it later on. But after that, whenever Deepak and I and many of the people on the forum, we have dinner together in our guest house, I have this special preparation for him, which goes very, very well with him. He has no allergies, nothing. He's absolutely fine. So, a very good evening. We had record 120 participants today. So thank you very much to all the participants. Thank you very, very much to our eminent panelists and of course the inimitable Mr. Deepak RAO. More people know about heart attacks and strokes and COVID and hypertension and diabetes than they do about allergies. And allergies can be a real pain. They can be very chronic. They can even be life-threatening in many cases. And I think Chef used the word, this presentation as well as the exchanges were very, very lucid. It was easily one of the best sessions. And when you say a best session, it need not be only a one-way traffic of trying to teach you. There has to be a good amount of understanding and a good amount of exchange. And I think in ample measure, that purpose was served. Thank you, CEO Forum, and we look forward to many, many more such educating as well as entertaining sessions, and look forward to a great weekend. Thank you very much, and good night.